You're listening to the Ethos Athletes Podcast, where we believe that your health is the number one resource you need to accomplish your dreams. My name is Dr. Hernandez, and I'm a physician dedicated to helping my patients maintain their active lifestyle and continue doing what they love. I'm sitting down with other experts so that we can provide our listeners with the knowledge they need to improve their health and live their best life. Hey everyone, this is Dr. Matt, and you're listening to the Ethos Athletes Podcast. And today we're going to be talking about an approach to joint pain that I don't think a lot of people know about and why this approach works really well. So with me on this podcast today, I have Dr. Ethan Kellum, who is an orthopedic surgeon and the CEO of Nashville Regenerative Orthopedics. He's a former assistant physician to the Boston Celtics. So Dr. Kellum, welcome back to the show.
Hey, thank you very much.
What we're going over today is talking about joint pain in general. And so a lot of people, don't understand that, there's more to, the looking at shoulder pain, knee pain, than the pain is, just the pain's right here. And so we kind of want to go into the comprehensive approach that we both use and agree on and have found to be really successful. So I met Ethan over in a regenerative medicine training. So we both specialize in regenerative medicine. I met him back at a conference in July earlier this year. And so, chatted with him, loved his approach to medicine, a fantastic guy. And so I wanted to bring him on and have him here for this podcast. So thanks for being here, Ethan.
Yeah, no, thank you. Thank you for having me.
So let's get the conversation started. So in your experience, you're an orthopedic surgeon. Why is treating joint pain more complex than it seems?
Well, a lot of folks, and sometimes when we're trained, honestly, as we go through this, that we're trained to focus on one area, one part, right? So someone's going to come in and they go, yeah, I've got this shoulder pain, or I've got this knee pain.
Yeah.
And so, when you start to look at them, you realize that, hey, it's not their shoulder, it's really their back, or hey, it's not their knee, it's really their hip, or their neck or something like that. And so, in the days now of insurance and, 15-minute appointments at the most, people are like saying, I'm going to focus on this one area. But when you look at a joint, there's so many things that go into that besides just the joint issue, the things like stability, nerves that go to that joint, articulation within that joint. There's a host of things that really matter to feeling that pain in the joint. And so you have to really, I think, take a moment to step back, see exactly what's happening, what's causing that pain to properly treat it. Because if you said, well, if you just looked at, hey, it's the joint, and you do something right at the joint, you're missing probably 3 or 4 other things that actually would make that better.
Yeah, no, absolutely. And that's what I found too. It's people will go and say, okay, well, the pain's, right here in this spot, and they expect something to be done just to that spot, and that's it. And there's more to it. I mean, we can prevent it from coming back. We can do all this other stuff instead of just, temporarily taking it away.
Yeah.
What do you see other medical professionals miss when it comes to assessing joint pain?
Well, once again, sometimes it's a function of time. But when you ask that question, there's a patient that comes to my mind. There's a patient that I saw probably a year ago, and she came in and she had seen another orthopedic surgeon, and he said, she was being evaluated for her knee, and she said, he told me that I needed a total, and so when I evaluated her, truly took the time to look at her, it wasn't her knee that was bothering her, like inside her joint. She was really having some IT band issues.
Yeah.
And I think that story illustrates this very classic point that trying to make, which is that sometimes we get in a hurry as providers, as caregivers, and just the way we're trained. And we forget to really look and see now what is truly the problem. And I think that happens more than I'd like to admit that it does. and so I think a lot of folks are either because of time or because, it can be a complex thing to really look at what's causing the pain. Like you got to evaluate not just only the joint, but the stability of the joint, the muscles around the joint, the nerves going to the joint. And so that can take a lot. And usually it's more than what your 15 minutes will allow you. And so I think on a whole, we really miss what is truly causing the problem. And so that's where we have failed the public in what we've done or doing for them.
Yeah, no, I completely agree with that. And I think that one, and I don't know if you'd agree with this. I think that one factor that comes into play as well when someone's assessing joint pain is what's in their toolbox, right? So sometimes you only go like if it's like if a medical professional only has, you can pick chiropractor, physical therapist, orthopedic surgeon, whatever it is. If you only have a certain tool to address a certain piece, like usually, we kind of subconsciously assess that and you only see, okay, can I fix it with the toolbox that I have? And if you can't, or let's say you can, you only address that one part and you might miss other spots.
Right. Yeah. I think you really have to, I agree with you. You really have to look at everything to really get to the bottom of what's going on.
Yeah. So speaking of looking at everything, what approach have you found to be the most comprehensive as far as when you assess joint pain? And this is an approach that we both use, but I'd like you to start off explaining it.
Yeah, so it's called the SANS approach. So the first S is for symmetry. The A is for articulation. The N is for neuromuscular, and then finally the other S is for stability. And so those are the four things that you really you need to look at when assessing someone's joint and seeing what's causing the problem.
Yeah, it's perfect. So let's dive into that a little bit more. So when you're looking at symmetry, when we're using the SANS approach, what are you looking for as far as symmetry goes?
Yeah, well, so it's very it's one of those things. It's what you want to see is this side like the other? Is the front like the back? Is the left like the right? And you can tell a lot of things by looking at just, is the muscle on this side like the muscle on that side? Mm-hmm. That's going to tell you a lot of things. Is it aligned the same way? And all those things factor into what's causing pain, because when the symmetry is off, and it usually has to do with muscle imbalance, when those things are off, that's when you have pain, because then things don't function the way they should. And so that's an easy thing to assess, right? Just like, what does it look like compared to the other side, or does this look normal? Does this look symmetrical? Mm-hmm. And it's something quick and easy, but something often that we just don't do. Right. Because we're in a hurry, or, so on and so forth, or we may not believe in it. Some folks don't believe in that. Mm-hmm. But symmetry is huge.
Say again?
But no, I said symmetry is huge.
Yeah. So, and I think, in my opinion, when we're looking at symmetry, I feel like that's kind of where it all starts for the most part. I mean, if you don't get the symmetry seems to be like a kind of a domino. It has a domino effect and just kind of builds up from there to some of the other problems that we see. And I know, the way I look at symmetry is essentially there's muscular symmetry, and then there's like structural, like bone alignment and stuff, right? And so making sure that both of those are sound, is really where the foundation of movement kind of begins, and then you can go from there. And if one of those falls, then other stuff starts to fall as well.
Yeah, it becomes a domino effect.
Yeah, absolutely. So what about articulation?
So articulation is very important, right? So, on the end of bones, you have cartilage, and let's take the knee, for example. So on the end of bones, you have cartilage, and then in between those two bones, you'll have soft tissue, meniscus. And those things are there for a reason, right? Cartilage is on there at the end. This cushion is there to allow the bones to glide over one another the way they should, right? So the cartilage is kind of like ice on the end of that, and when it's nice and healthy, it moves the way it should. And that cushion is in between to take the stress. When we run or jog, we're having 7 times our body weight, as we we place on those joints. And so that cushion in there helps with those things. So when those things go awry, the structural points, those things, when they're not the way they should, then it can affect pain and symmetry and things like that. So so the articulation is very important. And one of the things that a lot of people don't talk about when it comes to the articulation is what actually is inside that joint. So we talked a little bit last week about the factors that are in there that can also cause joint pain, and you get swelling and inflammation and those things. So so you have the articulation as far as the structures that are inside, but also what's in that joint fluid, what's in that knee or that shoulder, or your back, or all the joints of your hands. That also plays a huge part into whether or not you have pain.
Right. Yeah, absolutely. And articulation, like you said, that's when we're looking at cartilage. Like if we're looking at the knee, cartilage, meniscus, all that stuff.
The labrum goes into that.
Yeah, labrum, all that. Yeah, like what's going on directly inside. When I explain this to patients, I'm usually saying this is what's going on between the bones. Mm-hmm. This is what when I'm assessing this part, I want to know what's going on inside the bone. And then, and we kind of, go from there and determine if the pain generator is coming from that spot as well.
Yeah.
And then let's talk about neuromuscular.
Yeah. So this one is a big one, and one that is often just forgotten. So you have to think about it kind of as a chain, right? The nerves, one, are going to sense the pain that you're having. Mm-hmm. And sometimes that, what you're sensing could be at the place where it hurts, right? Or sometimes it could be up the road on that chain of the nerve. And so nerves are very important because one, they're going to sense the pain. Two, they're going to innervate the muscle, right? And then the muscle is around the joint or attaches to a tendon that's going to move the joint. And so anywhere along this chain, and those things, when the nerves are affected and then the muscle is affected, can affect whether or not you have pain. And so the muscles are very important around joint because they're going to keep them where when you do move them or use them, it keeps them aligned, keeps them stable. And so let's say that you had a nerve damage to a particular nerve that innervated a muscle. Now that muscle is weak. And then because the muscle is weak, now that joint isn't stable, doesn't move the proper way. And so that can cause you issues. So although the end result may be the joint pain you're having, but really the problem is up the road, right? With the nerve, or even potentially the muscle. You'll splint it a certain way. You'll hold it. You may not move it, right?
Right.
Motion is important for joints, and if a muscle doesn't work well and doesn't move the joint, then that can cause problems. The nerve is aggravated or irritated. That's going to cause problems. So neuromuscularly is very important. And although you may say, hey, we have arthritis in the joint, that arthritis could have actually been caused by a neuromuscular problem. So, and so if you're really, once again, if you're trying to do a very good job at treating joint pain, arthritis, whatever it is, you have to really be interested in the muscles that are around that, the nerves that affect that, because if you don't think about those things, you won't do an adequate job of treating that joint.
Yeah, absolutely. And you brought up a really good point that I'd like you to elaborate on a little bit more, where nerves, if a nerve problem can lead to arthritis. I don't think a lot of people understand this, and I think it's still somewhat of a new concept in medicine that people are catching on to and understanding a little bit more. But can you explain that a little bit?
Yeah. So nerves are going to, once again, innervate the skin around joints. It's going to innervate the muscles around that, and it's going to help the muscle keep the joint aligned, keep it stable. And so when you affect that nerve, once again, it's going to affect those tissues. And when those tissues are affected, then you have then the joint will move in an abnormal way, or it won't be stable the way it should. And so when you have that instability of a joint because muscles aren't there, or tendons don't work well, they're connected to the muscles, then that joint is going to move abnormally. And because of that, then you're going to have this wear and tear that you wouldn't necessarily have because the joint is off. And so that's how you develop arthritis. Arthritis happens over time because things are loose, things aren't stable, and it starts to, wear and tear. And so, it's one of those things that you gotta think about the nerves and treat them well too, or the joint's not going to do well.
Right. Absolutely. And then let's talk about stability.
So stability is one of those things that's important also. And I like to think when we talk about stability around a joint, if we're looking at, let's take, for example, a knee, and you've got the ligaments and tendons that are around that. They're kind of like the duct tape of the joint. And so when that duct tape is either loose or too tight, then that joint's going to respond. If it's too tight, it's going to have abnormal stresses, cause arthritis. If it's too loose, it's going to move in a way that it shouldn't move, and it's going to cause arthritis. And so it's kind of like Goldilocks and her porridge, right?
Yeah, for sure.
It's got to be just right. And so over time, ligaments get loose, joint capsule gets loose, and when that happens, you then have abnormal wear and tear on that joint, and that leads to arthritis and leads to pain and things like that. And so you have to really consider about what does the joint capsule look like and the stability there? What does those ligaments look like and the stability there? And you have to treat those things accordingly, or once again, you're not doing a very good job when you're trying to make someone's joint pain better.
Yeah, no, it's perfect. Now, when we're looking at, so we talked about symmetry, articulation, neuromuscular, and stability, all as components of addressing joint pain. Is there, we're going to have like a whole series on treatments for each joint, stuff like that down the road. But in general, have you found, what therapies have you found to be beneficial for each given one? Or, yeah.
So, one of the things, and I'll just call this physical medicine, whether it's massage, whether it's things like rolfing, things like obviously physical therapy. Those things can help strengthen, help, because tendons and ligaments respond to stress, right? So if they're being stressed appropriately, they're going to get stronger and do that sort of thing. So obviously that's one of the first things to think about is kind of the physical medicine to do. And then we'll probably get into this, I'm sure, but nutrition, right?
Absolutely.
How that affects joints and neuromuscular things. I mean, there's all sorts of things. Some of the big ones, right? Taking turmeric and resveratrol,
right.
Glucosamine, chondroitin sulfate, all building blocks that help joints do what they're supposed to do. And then you move into the things kind of in our realm of using things like prolotherapy, PRP. That can help with healing and strengthening. And prolotherapy is one of the biggest ones, been around for the longest time.
Absolutely.
Help strengthen tendons, ligaments. And even, if you start to think about how the neuromuscular with nerves and things, putting things like that around the nerves and helping those be better too.
Right.
To stability. So you've got a host of physical medicine. You've got injections that you can do, and that really plays into how it affects a joint.
Yeah, absolutely. And I'm assuming that you take all that into consideration as you go and treat people, correct?
Right. Yeah. And then you start thinking about other modalities, right, that you can potentially do, whether it's infrared or, things of that nature that, play into that. So, you definitely want to look at all of those aspects. So your goal is to get that patient to feel good. And if you kind of work in a silo with that, they may feel better for a little while, but they'll eventually get back to that point.
Yeah, no, that's perfect. And, kind of the way I sum it up to my patients, when we go over those 4 components again, we have symmetry. So I always tell my patients, symmetry has to do with spinal alignment or structural alignment plus muscular symmetry as well. And that's in my practice, that's one thing I do not address. And so I usually refer either to chiropractic or I refer to physical therapy for that piece. Articulation, what's going on between the bone, that's the one that, physical therapists, chiropractors, they can't, and anything like that. They don't really have therapies to treat inside the bone. That's kind of where our regenerative medicine stuff comes in. That's where the surgery piece comes in, if it's too far damaged. stability, neuromuscular is nerves and muscles. So there's some therapies that I do that help with that piece, as I'm sure you as well. You mentioned Prolo, you mentioned some of that stuff.
Yeah.
And then for stability, which is what stabilizes joints, is ligaments, tendons, muscles. And again, on the ligaments and tendons, regenerative medicine works super awesome for that. So there's times when it might be surgical, right? And then the muscular piece is usually some physical therapy. And so I kind of tell my patients, this is the breakdown of each component. This is the area that I can address. And if I can't address it, then I'm usually sending you to someone who can fix that part so you can get back to, being better 100% as opposed to feeling good just part of the time or with just some activity. So, yeah. And I think one important thing to look at too is that if someone's having joint pain, there's times where it could be just a stability problem, but most of the time it's a combination of these. Right. Do you have an example of a patient case that you saw, multiple, like a few of these come into play, or even all four of them?
Well, yeah, one of the biggest ones that we see a lot of is folks that come in with having either radicular symptoms down their leg. So their pain is in their leg, right? Yeah. But it's really coming from their back. Uh-huh. And so, you could say, and sometimes they may say, gosh, I feel it in my hip, or I feel it in my butt, or, things like that. But really, it's coming from their spine. And so when you look at their spine, you realize that, okay, so their alignment's off, right? So they could have, loss of curvature in their spine, right? And so that's going to mess with their symmetry. And then you're going to look at, they've got, where the nerves come out, the keyholes, they've got some stenosis there, or that nerve is just angry and it's fired up and it's having problems. So you want to address that. And then even just the kind of the stability of the spine. So the ligaments and things around that can get loose and lax, and that's why the curvature is off. And one of the things that's very interesting in the spine, when you look back, especially on an MRI, and you'll see this with folks, that there's muscles that are right around the back of the spine bones, called the multifidus. But you'll see that folks that have back pain, those muscles will have atrophy to them. Yeah. Yeah. And you really want to, you got to treat that, you got to do something to try to address that, either with activating that muscle or helping that muscle perk up through, things like some IRAP and A2M and some of those other cytokines and things like that. And so, once again, if you were just saying, oh, this person has back pain, and you're just going to inject their facet joints or transforamen or something like that, and you leave out the segment of the ligaments that are lax, it's, you're not really doing a good job as far as addressing that. And so that one is huge. You have other things that, we've known a long time in orthopedics. And one of the classic one is you'll see a 13-year-old girl, right? And she comes in, she's like, man, I have the worst knee pain. And get x-rays, MRI, it looks great. Well, then you look at her hamstrings and they're as tight as a tick. Right. And so you have to address that. When you address those hamstrings, their knee pain gets better. It's amazing to watch that. Yeah. And so, if you didn't think in that way, as far as, hey, it could be something else besides just like the joint, because you look at their joint and it's pristine, right? MRI and whatever, but they still hurt, right? If you don't assess what their hamstrings look like, then you're not gonna. One, you're gonna either say, hey, they just have pain. I don't know what's causing it. But if you take that approach of looking at all these things, you'll figure that out. You'll go, man, your hamstrings are super tight. Like, let's make that better, right? And normally they're so, and it's like a thing, things in pictures that we see, because of the way in which they throw, they'll get out of balance. And when they get that way in their shoulder, you'll get shoulder pain. Right. And so when you can restore that balance, whether it's with nutrition, it's with looking at neuromuscular things, the stability, making sure they're symmetrical. Yeah. That's when they get better, is when you look at all of them versus just one of them.
Yeah, no, absolutely. And that's been my experience too. There's a lot of times where, I liked your example of the knee pain where, you have someone, I get patients who come in with knee pain. In this case, they might be older, they like to hike, play golf, whatever. And and they're kind of limited because they're stuck with their knee pain. And then I'll go and I'll look and, okay, yeah, they have some arthritis. They have issues within the knee itself, maybe some nerve problems, their quads are tight, different things like that. So I'll treat that. And, and then I'll go and look and their knee pain is a symptom from, them having hip weakness. And so then I'll go and send to physical therapy to get the hip weakness addressed.
Yeah.
Or you look at like shoulder pain. I see AC joint pain a lot. Mm-hmm. So I'll treat the ligaments to stabilize the AC joint again. Treat inside the articulation piece to help with some of the arthritis that's developed. And then after that, you look at like rotator cuff muscle strength. That's off. They have a little bit of scapular winging, and so it's it's just an unstable shoulder. And so I always tell them, okay, I can go and treat this part, absolutely, but it's going to come back if you don't get that muscular stability and symmetry back. And, and so that's,
You mentioned the shoulder, and this always brings me to one that's huge. I remember there was I was a fellow, and we were having a lecture by one of the shoulder gurus in this country, and he hammered about core strengthening for shoulder pain. I thought, man, this guy has no idea what he's talking about. But it is, but that's it. If your core is weak, you'll have shoulder pain. And so it's like, once again, you can try to do all the things you want to that shoulder. If you don't address what all the other things that's going on with them, you're not gonna be able to help them as much. If you look at that, and so core strength is huge for shoulder pain.
Yeah, absolutely. And again, that's the benefit of taking this more comprehensive approach, like the SANS approach, and really understanding that, as opposed to, okay, the pain's here, let me just treat that one spot, or and so the results are a lot better, and the outcomes are a lot better when you take this approach. As I'm sure you've seen as well.
Definitely helps out so much more with the patient.
So today we covered the SANS approach to joint pain, which both myself and Ethan believe is one of the best approaches to addressing joint pain or diagnosing joint pain. And so we both have used this. We found it to be successful in our practice. And it just essentially is a comprehensive way to look at the joint and make sure that everything that is causing your pain is getting addressed. So Dr. Kellum, would you like to add anything else for our listeners to take away with?
Yeah, the biggest thing is that, one, just for your own health and your own issue, definitely, take these things and say, okay, are all of these things being addressed with what's going on with it, whatever pain that I'm having, whether it's my shoulder, elbow, and just so you kind of know what's, how to address it for yourself if the person you see doesn't necessarily look at it like that.
Yeah, no, that's awesome. So we're, myself and Ethan are excited. We have a regenerative medicine series coming up where we talk about regenerative medicine, which is kind of the next generation of treating joint pain, and we both specialize in this. So we're going to be discussing what regenerative medicine is, what that entails, and then we're going to be going through joints, through the shoulder, through the knee, all that stuff, and talking about what can be done, how it can be treated, and talk about some of the studies that have come out on regenerative medicine for a given joint. So Ethan, thanks again for being here today.
No, thank you.
And we look forward to catching you on the next one.
Yes, looking forward to it as well.
Thanks for listening, everyone.